So my name is Natalie, and I'm here tonight very gladly to talk to you about screen time and unhealthy eating in childhood and how we can promote healthy behaviours. If you're here for anything other, I don't mind if you slip out. If I'm talking too fast or if you've got any questions as I'm going through, please don't hesitate to interrupt me. That is absolutely fine. So I'm going to start on this notion of childhood health as a parody. The topic of childhood and adolescent health has often been considered as paradoxical, simply because while childhood and adolescence is often considered the most healthy time of life, it's also the time of life where unhealthy behavioural habits become established, such as screen time and unhealthy eating. Childhood is a critical period for the establishment of such health behaviours, and healthy behaviours in the school age years really lay the groundwork for future lifelong health and well-being. So I'm going to ask a question. What do you think is the biggest lifestyle change for children in the past generation? Does anybody want to yell out? Could be anyone. Technology, thank you. Screen time or digital media or screen use, it's got a whole host of connotations or ways of describing it, but we do now live in a smart society. There are more internet-enabled devices in the average UK home than people. On average, it's about 8.3 internet-enabled devices in the home. Britons, and this is children, spend more time now on screens than they do sleeping. I think the average is about 8 hours and 40 minutes for sleep, and we spend more time on screens. 1 in 4 children have a TV in their bedroom by the age of 3. 5% of 5 to 7-year-olds, and then almost 40% of 8 to 11-year-olds have their own smartphone. 20% of 3 to 4-year-olds, 35% of 5 to 7-year-olds, and over 50% of 8 to 15-year-olds have their own tablets now. So we are engorged in this technology environment. Yeah, I should also add that 52% of children now prefer to read on a screen compared to 30% who prefer printed books. 70% of primary and secondary schools now use tablets in school. So when I'm talking about screen time, I'm talking about time. I'm not really going to go into content of screens and context a little, but I'm really going to focus on time. When I'm talking about screen time, I'm talking about a domain of sedentary behaviour. Sedentary behaviour is sitting, or it's been defined as any waking behaviour characterised by an energy expenditure of less than 1.5 metabolic equivalents, while in a sitting, reclining or lying position. So we're talking about sitting. And screen time is the most prevalent sedentary behaviour in our society. When I'm talking about screens, I'm talking about tablets, smartphones, TVs, computer games, and all of the other screens that I probably haven't even heard of yet. Screen time, screen use, digital media use, I've even heard of somebody calling it screen consumption, which I'm not a big fan of, can refer to a number of different mediums, such as smartphones, tablets, like I've just said, which can support different applications or functions, so the internet, social media, video, gaming, and passive watching. These can further display a range of content, educational, entertainment, violent, adult content, and can be interacted with in different ways. Passive watching of content on the TV, or active use of internet and social media, and even co-viewing with others. What I don't want to do, and I hope that I don't, is demonise screens. That's not my plan today. I'm not going to sensationalise any of the headlines that we hear in the news. What I'm going to present to you today is all evidence-based. Technology is now accessible in every part of the world almost, and it has completely changed the way that we live and interact with each other. I'm not going to take that away. digital media is embedded in our 21st century society, and with recent technological advancements, the number of opportunity to be exposed to digital media has increased incomprehensibly, and we cannot reverse these advancements. It's simply too late to put the digital media back in the lamp. My daughter was very keen for me to put Aladdin on there somewhere. Technology is all around us, all of the time. And while this has a huge impact on how we live, behave, how we think, and how we interact, a lot of this is negative. There are benefits, a huge array of benefits, in fact, for young people. First of all, I just want to say, I'm talking about screen time, but myself, when I'm talking to students and when I'm talking to other people, teachers, and government, I think, lumping all of screens together and calling it screen time is not always very helpful. Okay, not all screens are created equally. Almost using the screen time suggests that its benefits are limited and that it should be used sparingly. Screen time is a really nice sort of way to categorize what I'm talking about today, because it's relatively simple. But when you start to separate out all of the different screens and all of the functions that they have, the effects that we'll see will start to vary. When I talk about digital literacy, this is a beneficial use of screen if used in the right way. What I'm talking about is the knowledge and skills needed to use technology, to analyse, learn and explore play, which is an important role in children's ability to succeed in society today and in the future. The Department of Education realises that digital literacy is a very important skill for children growing up in our digital society, and they've incorporated computer science and digital literacy in the curriculum since 2013. There are educational, cognitive and positive behavioural benefits of screen use if used in the right way. It gives people, children in particular, the ability to build an awareness of past and current events at the touch of a button. And it connects the world. It gives us this kind of social capacity that we wouldn't have otherwise. While there are benefits, I'm talking about screen time because, irrespective of the content or educational value of what is being viewed, the sheer amount of time that we spend in our leisure time or discretionary hours, if I'm talking about children, is increasingly being considered an independent risk factor for ill health and disease. That's why I'm talking about time today. This is recognised by governments around the world and has led to guidelines and recommendations for screen time. In the UK, we don't have a specific guideline for screen time. We have sedentary behaviour incorporated into the Start Active, Stay Active guidelines. These are currently being updated, and screen time may appear in the next set. The American Academy of Pediatrics has recently updated their recommendations, and the long time no screen before the age of 2 rule has been sort of taken out, and now they're suggesting other things. These guidelines come with a huge amount of advice and practical guidance to parents, which is a really nice thing about these guidelines. Despite the guidelines and the recognition that screen time is a problem, I'm going to talk now about the prevalence of screen time. And I was horrified to find this picture of a child strapped into a bouncer with a screen. Anyway, so this is the percentage of children with access at home to these devices. So you can see TV sets are the highest there. Tablet use in the younger in the younger children has increased, as has mobile phone access in the older children. This is the percentage of children who own their own tablet or smartphone. As you can see, from about the age of 7.5, 8, children have their own tablets, and the smartphone tends to overtake the tablet at around age 10. This is an estimated weekly hours of screen time. This is the most recent UK prevalence rates. And as you can see, TV viewing is the highest for all of the age groups apart from the 12 to 15-year-olds, where the internet takes over. This is the average hours spent watching TV, online and playing digital games per day, broken down into school day and weekend day. Weekend days, 3 to 4-year-olds are spending more than 5-year-olds on screens, as are 5 to 7-year-olds, which goes up to over 6 hours for 8 to 11-year-olds, and more than 8 hours a day on a weekend day in 12 to 15-year-olds. What this doesn't take into account is this new phenomenon of multi-screen use. So a lot of adolescents, these 12 to 15-year-olds, will be sitting, watching the TV, also online on their phones, or playing games. So this doesn't take into consideration that. So 8 hours seems like a huge amount of time, but it doesn't take into consideration that multi-screen. So use those numbers cautiously. This is the devices used for playing games by age and by year. And you can see a decrease in games consoles connected to the TV, whereas you can see an increase in tablet use and also an increase in mobile phone use across the ages. This is weekly internet use by age and by year. And as you can see, across all age groups, the internet use has increased quite dramatically. Boys, I haven't sort of put any sort of gender differences and things onto these slides to try to keep it nice and clean, but boys play games more than girls. Boys spend more time on the internet than girls and online. The girls spend more time on their mobile phones. And the difference is in the number of messages that girls send. Girls send about 175 messages a week on average, a lot more in others and less in others, compared to boys who send about 108. And this just shows the devices used for the internet. And as you can see across all age groups, the tablet is increasing, and in the older age group it's the smartphone that is increasingly used. I will add that these numbers are exacerbated in children of high deprivation. Children and families who live in, below the poverty line spend an enormous amount of money keeping up with digital technology, money that they can't use to put on controls to keep up with software and things like that. A disproportionate amount of their income is spent on screen time, and that is reflected in the prevalences of screen time in those higher deprivations. They spend a lot more time using screens. So it's clear that much of children's leisure time is spent using screens. This is going back to weekday prevalences, up to 5 hours a day. When you think that 6 hours of that 24-hour day is spent at school, and then you've got 4 hours spent on screen sitting, it's a huge amount of time that is taking time away from other things perhaps. So how has spending more time on screens changed the lives of young people today? One of the big topics in this area is that the more time we spend sedentary at screen, the less time we have for play. So I'm going to show a short video. I thought that kind of summed it up quite nicely, that this is one of the big sort of topics, that the more time we spend at a screen, should probably flip over, the less time there is for play. And more screen time means more sitting, because we generally sit when we're using screens. In children, in the UK, sitting is the most prevalent behaviour, not sedentary behaviour, just the most prevalent behaviour during waking hours. 65 to 70% of a children's waking time is spent sitting. That's about 7.5 to 10 hours a day spent sitting. The modern way of living has almost removed the need to move. From Netflix and Amazon Alexa, to searching for air tickets, shopping for groceries, to holding meetings virtually. So much of what we do, and so much of what our children are growing up in, is at the touch of a button, while sat. So why is this important? Why is it a concern for health? Why are we all here? Screen time is linked to a lot of health outcomes. Most of these are negative, and I'm not going to talk about any of these in any detail. This is the evidence. This is where the links are in the literature. I'm just going to give a few examples. Technology, I'm talking about all technology, is an addiction based on how TV programs, video game use and the internet addictions share characteristics of other addictions. Emotional shutdown, tantrums when you turn off Peppa Pig, lack of concentration on other things around screens, and withdrawal symptoms if and when screens are taken away. Adolescents who spend substantial amounts of time in front of screen devices and are distinctly less happy than those who engage in more face-to-face and social interactions. I haven't put this on the screen, but there was a recent study in the United States of over 500,000 adolescents who mapped the emergence of smart technology from the start and the introduction of the smartphone onto the increase in rates of depression in adolescents and the increased rates of suicide. Okay, so it's an important topic. The growth of virtual reality versus reality-based play will have an impact and affect how children's experiences affect their physical, cognitive and social development. And these are just very crude comics that I thought I would put up just to lighten the mood. Excessive screen time is also linked to lower levels of physical activity and erratic and disrupted sleep patterns. It's also linked to unhealthy eating, which takes me on to the second part of my talk. When I talk about unhealthy eating, I'm talking about these HFSS foods, high fat, salt and sugar foods. I'm also talking about low levels of fruit and vegetables. In the UK, we have our guidelines for fruit and vegetables, which are 5 a day. We don't meet them. This is the most recent data that we have on the prevalence of those 5 a day guidelines, and as you can see, we're far from reaching them. And these are children from age 2 who have the highest mean proportions, down to the adolescents who tend to have the lowest. This is the percentage of children aged 11 to 16 consuming 1 piece of fruit or vegetable per day. And as you can see, the numbers aren't particularly great for that either. As with screen time, these prevalences are hugely exacerbated in families of low income. They spend their money elsewhere. Fruit and vegetables often aren't available in their communities for them to buy. They often don't know what to do with vegetables in particular, and they just don't have that concern, I suppose, for their children to have those fruit and vegetables every day. While we're not snacking on fruit and vegetables, we are snacking on other things. Sugar, and added sugar in particular, makes up about 13% of children's daily calorie intake, while the official recommendation is to limit it to no more than 5%, or 24 grams, I think it is. Worryingly, teenagers continue to consume more than 3 times the recommendations for sugar, about 15%. So these are the current intakes of sugars as a percentage of total dietary energy intakes for men in blue and for women in red. And the new 5% recommendation is there in the red dotted line. And as you can see, everybody is far exceeding that. So we've got a lot to do. This is where we're getting our sugars from. In 4 to 10-year-olds, the sources of free sugars are mostly beverages. I'm not going to talk about beverages because that's a whole other topic, and I could be here until the weekend talking about that. But mostly they're coming from cereal and cereal-based products such as biscuits, cakes, cereals, sugar confectionery, chocolate, ice cream, sugared yogurts, and so on. In 11 to 18-year-olds, the beverages increase, but we see a similar sort of proportion coming from these cereal-based products and sugars and added sugar-based confectionery and things. You can see that the recommendation is 24 grams a day. 84 grams for boys and 64 grams for girls on average. Like with screen time, there are many clear benefits to diets that are rich in fruit and vegetables and low in energy-dense snacks foods. From childhood onwards, in enriching the fibre and macronutrient content of the diet while reducing its energy density. Diets high in fruit and vegetables and low in energy-dense snacks have been linked to weight, development of many cancers, cognition and mental health, cardiovascular disease, blood pressure, bone health, cholesterol, and a lot of other things that I just couldn't fit on. Furthermore, both screen time and unhealthy eating track through childhood into adolescence and into adulthood. This continuing of behaviours increases the risk of developing conditions like obesity and diabetes that shorten people's lives and put a huge burden on the NHS. The fact of their youth and the children that we're talking about means that there is time to prevent damaging health behaviours from becoming habitual. We've got time to help children establish healthy behaviours. Importantly, and my sort of research interest, is the fact that health behaviours like screen time and unhealthy eating, they don't occur in isolation. In the real world, they coexist. There's a huge and growing body of research suggesting that unhealthy behaviours like low fruit and vegetable consumption, high screen time, high energy-dense snack consumption, they form together as behavioural risk clusters in children. And what I mean by that is that high screen viewers tend to also have high energy-dense snack food intake and lower fruit and vegetables. They kind of go together to form these clusters of behaviours or patterns of behaviours. The odds of having these multiple risk behaviour clusters increases over time, particularly during the teenage years and over the course of development. While individual behaviours, so individually looking at screen time and individually looking at diet, is important, the fact that they go together exacerbates the risk to health. And that's why I think it's perhaps more important to look at these clusters rather than behaviours in isolation. As young people form these unhealthy behaviours and the clusters of behaviours that contribute to disease and the development of disease biomarkers and all of the other things that I've mentioned already, their combined effect on health extends beyond the individual contributions of each behaviour. For example, the benefits of moderate to vigorous physical activity can be reduced if children have poor eating behaviours and excessive screen time. Therefore, it's the combination of these behaviours that's important with respect to health. And it's this parody that childhood is this inherently healthy period, together with this evidence that I've just shown you, that makes young people's lifestyle choices, particularly those relating to health behaviours such as screen time and unhealthy eating, an important area for public health consideration, because these behaviours are modifiable. They can be changed, and we should do something to change them. So my own research in terms of sedentary behaviour and diet is focused on sedentary behaviour, and in particular screen time and how it's associated with eating behaviours. And we've shown across 2 big systematic reviews that screen time is associated with lower fruit and vegetable intake and higher energy dense snack intake across children, across adolescents, across adults. As I've shown earlier, screen time is a contributor to obesity. In a recent invited manuscript to the European Sports Science Review, colleagues and I have shown the evidence suggesting that screen time and adiposity is mediated by diet, in particular, sleep, moderate to vigorous physical activity, and light. So the relationship between screen time and weight can be affected by these things. That's what I mean there. Weight is extremely topical at the minute. It's been on the telly. It's everywhere. There's a lot going on in this space at the minute. I think we're expecting some new guidelines and recommendations around obesity very soon. But these are the prevalences of excess weight by age and sex from the National Child Measurement Programme. I think it's 20% of year 6 children, 10 and 11-year-olds in the UK are obese. Nearly 10% of 4 to 5-year-olds are obese. Younger generations are becoming obese earlier and staying obese into adulthood. We come back to deprivation. These levels are hugely exacerbated when we look at deprivation in terms of most versus least, with the most deprived most likely to be obese. We know that obesity harms children and young people, and it's hugely topical at the minute. You might have seen Hugh Fearnley-Whittingstall's programme on BBC recently, Britain's Fat Fight. It's popular, and I want to quote Hugh because I thought it was a very engaging programme, and he said that obesity is caused by sedentary behaviours, sedentary lifestyles and unhealthy eating. We can do something about obesity, so let's do something about it. The purpose of my talk is screen time and diet, so that's the part of this framework that I'm going to continue to focus on. So I'm going to give you some examples now of associations between screen time and eating behaviours that have come from the research that we've done here. So this is from a project that was funded by the British Heart Foundation called Kids First. And this just shows basic relationships between an array of screen use and fruit, vegetables and energy-dense snacks. I've separated out fruit and vegetables because the way in which we eat fruit and vegetables is very different. I thought it was quite important for this to understand that the associations between screen time and eating, this is data from 5 to 6-year-olds, it goes beyond TV. Okay, you can see there that weekend day computer use is associated with energy-dense snack consumption. This is the same data but in older children, so 10 to 11-year-olds, and almost all of those screen devices and screen use are associated with energy-dense snack consumption. Very few with fruit and vegetables in this data. To go on, I'm to show you the percentage of children who fall into these groups of behaviours. And almost 19% of 5-year-olds had behaviours, so low fruit and veg, high screen time and high energy dense snack consumption. In 11-year-olds, this went up to 27%. So what is it underpinning this association between screen time and eating? Well, there have been a number of plausible explanations. Advertisements, a distraction of TV and screens, and associating TV with snacking. So I'm going to first talk a little bit about advertising. Now, this is a very popular space at the minute. There's a lot of stuff going on about advertising and revamping the children from harmful effects of TV viewing, but they typically focus on advertising targeted at, directed at, designed to attract the attention of children. These phrases are now seen as too narrow. Typically, the high fat, sugar, salt companies weren't allowed to target children's programs up to a certain amount. Okay. So this is an example. An episode of The Voice recently on ITV was watched by over 700,000 children. This one programme featured 12 ads for high fat, sugar and salt foods, including Domino's, chocolate biscuits, spreadable butter, and other things. In 2012, the World Health Organization came up with this framework for implementing the set of recommendations on marketing of food and non-alcoholic beverage elsewhere has an impact on food preferences. Research has shown that TV advertising likely has a direct impact on children's food preferences. Even though they don't know what that food tastes like, it increases their perception of the taste of food because of the power that these adverts have. Children-targeted advertisements also impact family. Though parents are perceived to be the primary decision makers in the household, children's preferences are the major influence behind people and parents buying these snack foods and meal preparation as well. Exposure to food adverts is linked to an increased consumption in patterns and obesity, and healthier food adverts are linked to higher intakes of healthier foods. So that shows the power of adverts. Adverts, this shows that food advert exposure increases intake in all children, but even more so in children who are overweight and obese. So the children who we don't want to be seeing these adverts are most likely to increase their intake from seeing them. Adverts go beyond TV. There are these things called advergames, which I had never heard of before, and the regulations and rules about advergames are completely different to the rules about advertising on TV. They have their own set. Advergames are designed to grab attention, and they're often sort of brand specific. So when you go on the internet, for example, Burger King has got its own game, which tries to draw young children in and almost tempt people to buy. That's the kind of premise behind it. And these are just a few examples of some studies that have looked at these advergames. So playing an advergame containing food cues increases energy intake irrespective of the product type. Playing an advergame containing food cues increases intake. Playing an advergame containing food cues increases intake, and rewarding children to refrain from eating didn't sort of mitigate against the intake, the effects of playing a game. feature in energy-dense snacks in impulsive children. So some children have, more sort of psychological tendency to be brought in by some of these adverts. The second sort of mechanism is this notion of the distraction of the screen. And compared with eating a meal at a table with no screens, eating at screens can cause a distraction, resulting in a lack of awareness of actual food consumption, or overlooking food cues, which may lead to overconsumption and increased energy intake that isn't then compensated for later in the day. Parents often use this to their advantage, perhaps, sometimes. These are quotes from parents that we've interviewed as part of some of our studies. We let child age 5 eat his breakfast while watching a programme on the iPad because he'll actually eat breakfast that way and we can get out of the house quicker. Yes, as soon as a girl comes in from school, she gets a snack and parks herself in front of the TV and often has her tea there too. I've started putting a few crisps in a bowl and giving them to the boy age 7. Otherwise, the family size pack would be gone while he plays the games on his TV. There's no other way to get him to try new foods than when he is zoned out watching an episode of said child programme on the iPad at the kitchen table. I've seen this firsthand on holiday where, the foods are different when you're abroad and children don't like the thought of trying new things in new environments. I've seen parents put whatever on the iPad and spoon feed 5-year-olds while they're concentrating on the TV just to get them to eat, because parents fundamentally want children to have food in their belly. So eating while watching TV results in greater food intake. 13% more calories than meals eaten with no screens. Absorption in a storyline, a game sequence, a chat, inhibits our ability to realise, to appreciate, and often to recall foods that we've actually eaten. There was a study with young children who had been given a lunch, either in front of a screen, a TV programme, or without, the same lunch. Children who had watched TV while they'd eaten their lunch couldn't recall what they'd had for lunch and ate more when they were offered an afternoon snack than the children who didn't watch the TV while they were eating their lunch. So it has this long-lasting effect throughout the day. Distraction prevents the body from paying attention to internal food processing cues and exerting the usual satiety level. So normally, when you're at a table eating your meal, you'll feel full, that satiety level. That's almost overridden when you're watching the TV or playing a game or any other screen. And the last one is this associating TV with snacking. And it comes from some really early research, really, where young people may associate TV with eating from a young age. For example, if parents put children in front of the TV, give them a snack or a meal while they get along with household chores. 1/3 of children aged 2 eat their meals and snacks while watching the TV or using a tablet. These early associations between screens and snacks become habitual and really difficult to disentangle when children age. So identifying these interrelationships or clustering of health behaviours in young people and focusing on the contextual factors that may either increase risk or operate as protective factors is really imperative for the design of public health interventions. To develop interventions to reduce this coupling of unhealthy behaviour, we need to understand the factors that are associated with these behaviours. And researchers traditionally focus on either screen time or unhealthy eating. In terms of context, where are young people when they're using screens and eating in front of screens? And who are young people with? Our research in Kids First show that more than 1/3 of the after school, and this is sort of 3:15 to 6:15, and evening 6:15 till bedtime are spent on screens. More than 30% of time was spent with families at home. 21% of after school and 43% of the evening was spent on their own, and almost half of this time was spent in their bedrooms. Around 90% of children eat their breakfast at home, and half of these eat their breakfast in front of screens. More than 90% of dinner of school-aged children is eaten at home, and 68% of this is eaten in front of screens. So health behaviours, as I've already mentioned, are established in childhood. They're established within the home environment, with parents' attitudes, beliefs and behaviours being the key influence on children's behaviours. Screen time and what children eat are big issues at home. Do any of these lead to difficulties or conflict between you and your child? Screen time and what they eat were two of the biggest ones. Nothing to do with what they do on the internet, phone or technologies, but the amount of time that they spend on screens. Parents have diverse approaches to deal with screen use and unhealthy eating. How parents approach their child's digital media use and eating behaviours varies widely. Some favour limits or restrictions and monitoring, while others use enabling or active strategies, including co-use, family meals and snacks, and talking to their child about what they use digital media for and what they're eating. Parents who use a combination of these approaches and model positive behaviours, including their child in setting limits, have children who are more able to assess the potential of and manage the challenges presented by digital media, and are more able to make healthier food choices. In Kids First, we looked at the correlates of these combinations of behaviours. So across the top we've got high screen time, low fruit and veg group, high screen time, high energy dense snack group, and then the 3 risk behaviour groups. Parent income was quite a big predictor of the 3 risks. Most of these were linked. So children eating breakfast in front of the TV, eating energy dense snacks while watching TV, parents' own TV viewing and parents' own energy dense snack consumption was linked to children being in this 3 risk behaviour group, and the home availability of energy dense snack foods. In children aged 10 to 11, a similar story, but much more of these correlates were associated with behaviours. Again, high deprivation was a big one. Habits, so children who had already got a high habit for watching TV were more likely to be in these more sort of risky behaviour categories. Children eating meals, children eating energy dense snacks, watching TV with parents, eating energy dense snacks in front of the TV with parents. The only one that showed a lower likelihood of being in the 3 risk behaviour group was parents' rules and limits on food and screen time. So can we promote healthy behaviours? I feel like I'm running over time a little. Okay. Given this behavioural interconnectedness between screen time and unhealthy eating behaviours, it is plausible that a reduction in unhealthy snacking behaviours may be equally well addressed by considering complementary or supplementary behaviours such as screen time. So is it plausible that reducing screen time will have an effect on diet? These are some quotes that we had from parents when we asked them this. I think it's just a habit now that my boy comes in, turns the computer on and gets some snacks. If he goes straight out into the garden, he doesn't eat until dinner. If we have our Friday night takeaway at the dinner table instead of in front of the TV, we all eat less. I know that when I sit at the table to read or check the post for that day, I'll have 1 biscuit. If I switch on the TV, I can easily have eaten half a packet before I realise. I like to come in and chat to friends online. I usually eat a packet of crisps, but if I stay at school later and chat there, I don't eat the crisps. Okay, so it is plausible that by reducing screen time, we could also reduce energy-dense snack consumption. Historically, intervention programs have targeted individual health behaviours, so just screen time, just eating. But there's been a recent shift towards interventions which are aiming to modify several behaviours all at once. There's not much evidence, but this is just an example. Gentile targeted children aged 7 to 10 to avert the documented declines we see in fruit and vegetable consumption and increases in screen time. They showed small to modest effects for promoting children's fruit and vegetable consumption and minimising screen time. And similarly, Kipping targeted reductions in screen time, servings of unhealthy snacks and fruit and vegetable consumption in 8 to 10-year-olds, and found positive results for screen time and unhealthy snacks, but no effect on fruit and vegetable consumption. No evidence to date has looked at whether targeting two behaviours is more effective than targeting one behaviour on their own in the same project, and this is something that we're doing here at the minute. Systematic reviews and meta-analyses show equivocal evidence surrounding the effectiveness of individual interventions versus multiple health behaviour interventions. And here I've listed, I don't really like this slide because too much writing, but some of the reasons for this evidence or lack of effect. So some studies have targeted both behaviours. Others target one but measure both. So some studies will target reductions in screen time and energy-dense snack consumption. Others will target screen time but measure both screen time and diet. It's really difficult then to disentangle whether it's a single versus a multiple behaviour intervention. There's too much focus, even now, on TV viewing. Screen time has evolved massively, as I've shown you, but we still focus a lot on television. A lot of the research is out of date and out of touch. Technological innovation is continually increasing at a rapid pace. Research, guidance, policy will struggle to keep up. So a lot of what even the stuff that I've shown you now is out of date because it was last year, and things have changed since then. Interventions aren't targeting the right populations. As I've told you, there's a huge gap by deprivation. Interventions aren't targeting the right time of day. Children, it's the after-school period on a school day. That's that critical period for screen time and unhealthy eating. But interventions aren't targeting that time of day. Interventions aren't intervening in the right setting. A lot of screen-based and unhealthy eating interventions are based in the school. Most of screen time happens at home, as is healthy eating, but we're not targeting the right environment. Alternative behaviours aren't considered in a lot of these interventions. When we tell children to turn off the screen, we have to give them something else because they'll just move on to the next sedentary behaviour. We need to provide them with alternatives. And also compensatory behaviours aren't considered. So if we get children to stand up all day in school, will they compensate in the evening by sitting more? These things aren't really considered traditionally. So what can we do to promote health and healthy behaviours? A colleague of ours from Australia has come up with this sort of conceptual framework for policy-relevant interventions to reduce children's sedentary behaviour. Now this can be applied also to screen time and multiple health behaviour interventions if we have the evidence base. It takes into consideration policy, scalability, reach, cost effectiveness, where we should intervene, who should we target, what to target, strategies for change, everything you need to think about before you design an effective intervention. So there are policies and guidance, as I've already mentioned, but these policy makers need to make tougher rules and regulations about advertising high-fat, salt and sugar foods to children. As I've shown you, there are regulations in place at present, but they don't affect almost 70% of the programs that children are watching. Clear, simple, scalable, specific, sustainable guidance on developmentally appropriate content, context and screen time are needed. Children who are 4 to 5 need different guidance to children who are 11 to 12. As with screen time, policymakers should make guidance on high fat, sugar and salt foods applicable and appropriate for all. We need guidelines and recommendations that will stand the test of time. And we need policies and guidelines that will almost transcend deprivation. The wrong way. I focus on family because we know that that's where these behaviours are developed. Parents interact with family, who interact with friends, and children-focused professionals, teachers, GPs, midwives, health professionals, all the way throughout their children's lives. These people have little training or no training to support these professionals in providing the right advice and guidance to parents. Parents need realistic, balanced, sensible guidance because they have a huge role to play in both addressing the risks that children face in a digital society and in enabling the opportunities that these technologies offer our children. Children are more digital and tech savvy than their parents now. Parents in most households now they're almost overwhelmed with what to do with screens and screen time. These are new challenges that parents need to be aware of, realise the importance of risks of screen time, and receive guidance on. I've used this developmentally appropriate term earlier, and it's applied to screen time a lot. But what is developmentally appropriate? Do parents know? This is what I found. It's whether use is purposefully integrated to support learning. Whether use is solitary or taking place with others. Whether use is sedentary or mobile. The content and features of the media that children are using. Features of the devices. And, of course, total screen time. So these are my sort of recommendations, and I'm going to sort of quickly nip through them because I'm very aware of time. Parents are fundamental gatekeepers in their children's health and health behaviours. Children look to their parents for everything. Parents are role models, not scroll models, is what I heard recently, which I thought was quite funny. Parents need to lead by example. I like this kind of graph that shows control over influence. Parents really lose control, or I should say influence takes over control as children age. This influence almost gives children the ability to be able to take care of themselves in an appropriate way on screen, whereas control means parents do everything for their children, whether it's through yelling, taking away screens. It's not educating the child to be able to defend for themselves in this digital world. Influence almost transcends time. If you're a positive influence, that's great, but negative influence also goes with this. Co-use. Children shouldn't really be left solitary on devices, and it's children from high deprivation families who are often left to their own sort of devices when they're using devices, because parents don't have the time or often the inclination or the ability to supervise and interact educationally with these technologies. Co-use is a recommendation from the American Academy of Pediatrics in their new guidelines. It's about being involved and sharing the positive experiences to advance digital skills and learning, to ensure that children know what's going on that screen and understand what it is that they're seeing. Having healthy snacks available at home is key, because children eat what's at home. Again, this is a challenge for families of high deprivation where access to good quality fresh ingredients is limited often. We need champions in those communities to show parents where they can go for these healthy foods, how to prepare them. It can be a family activity. We encourage in our Kids First programs that parents do this with their children. It gives the children that sort of learning of food and how to prepare it, but also time away from screens together as families. So making eating time family time. So meals to be eaten away from screens for the reasons that I've shared with you earlier. Having a bank of alternatives to screen time and unhealthy snacks is essential. When parents ask children to switch off or get something healthy to eat, children look blankly. What am I to do? What am I to do next? And they move on to the next sedentary activity, or they get a crisp packet instead of a biscuit packet. Having a bank of alternatives is essential to promote healthy behaviours. In Kids First, we provide our families with this A to Z directory of screen time swaps. So we gave parents an example for each letter of the alphabet of an alternate to screen time. We also came up with this idea of an activity jar where parents and children were encouraged to come up with all of the things they like to do that isn't screen-based. And when children say, I'm bored, or parents want children to come off the screen, we encourage them to go to this activity jar, pick something out and do that instead. We also have an A to Z directory of healthy fun snacks, and we give parents the recipes for these snacks and encourage families to make them together. Using tech tools online to monitor and to restrict time, and monitoring charts within families. We've used them for reaching the 5 a day fruit and veg, and children love having that chart stuck up on the fridge. Every time they eat a piece of fruit and veg, do a tick or a star, and seeing that they've met the guidelines and they've beat their sister or their brother or more than their mum and dad. It's a good way to get them to sort of really see what they're eating or what they're how much time they're spending on screens. Little nudges. Start small to resist any resistance. What I mean by little nudges, you might have seen this on the BBC programme that was on recently. Things that are eye-line are things that are bought more often, and it's the same at home. You open the fridge, and if the first thing that children see are chocolates, or if they open the cupboard and the first thing that they see are crisps, that is what they're going to have. If you haven't got prepared snacks or fruit and vegetables out that are ready, available, accessible for children to eat, they're not going to eat them. So it's about sort of little nudges that you have at home. Even moving, if you keep your iPad on the living room coffee table, putting it away so they can't see it as soon as they walk in through the door. They'll soon find something else to do. Having screen-free times and screen-free places within the home. Minimising screen time before bed. Screen time, particularly screen time before bed, has a huge impact on sleep length and disruptive sleep. And don't have screens in bedrooms. This is just a funny cartoon, I thought. In 1958, we'd send our children to their bedrooms for being naughty, and now we're trying to get our kids out of our bedrooms because they're spending too much time. Discussing with your children and sharing media plans. This is important because it gives children, it almost empowers them to create their own plans. When they're going to use their screens, what are they going to use it for? When are they going to have a treat, snack, things like that? They need to be talked about within the family to empower children. Plan their media use for young children like you'd plan a trip outdoors. Discuss, agree on media and screen limits and snacks. Screen use and treat snacks are not rewards. It's about a balance between screen and non-screen active behaviours. Children learn from education and influence, not taking screens away. So future research, things that we've got going on here, to have a better understanding of these underlying mechanisms between screen use, which can create risk and afford positive opportunities. We need longitudinal studies that look beyond one point in time, and experimental studies to establish causality between screen time and eating and screen time and health. We need more qualitative evidence to understand young people's experiences on the content and the context of this co-occurring of behaviours. We're looking into how hunger and appetite play a role in the association between screen time and eating. Is it the sitting or is it the screen? It hasn't really been disentangled. And also comparing multiple versus individual behaviour interventions on a further level. Yeah, and this is key. How we reach those most vulnerable people that need our help but are the least likely to take our help. So I'm going to wrap up. In summary, digital technology is growing at a pace that research, guidelines and policy struggle to keep up with. Screen time and unhealthy eating and unhealthy snacking co-occur in young people. Uncoupling these behaviours requires investment at a policy and guidance level to help families. Education and appropriate guidance is key to enable all people from all walks of life to be resilient to the unhealthy environments and to make healthy choice the easy choice. And I'll stop there. Thank you very much.